Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, July the 30th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, July 31st, we'll be providing a statement with case counts and other relevant information at around 3 o'clock tomorrow. Our next briefing will be next Tuesday after the Canada Day weekend. So let's see, that's August 1st, 2nd, 3rd, 4th. The BC Day weekend, right? It's the BC Day weekend. I'm almost right. It's the BC Day weekend. It's August next week, in fact, which seems incredible. So our next briefing after this will be next Tuesday, and then we'll be doing briefings in person next Tuesday and next Thursday of next week, with written briefings on Wednesday and on Friday. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today for our update, we have 29 new cases to report, bringing the total number of people with COVID-19 in BC to 3,591. That includes 1,076 people in the Vancouver Coastal Health Region, 1,865 people in the Fraser Health Region, 143 people in the Vancouver Island Health Region, 360 people in Interior Health, 86 people in the Northern Health Region, and 61 are people who reside outside of Canada. We have 242 active cases today. Of those, 5 are in hospital and 2 of whom are in critical care or ICU. We have no new deaths to report today, and our total remains at 194 people who have died from COVID-19 in BC. Additionally, we have 3,155 people who have recovered from COVID-19. We have no new healthcare facility outbreaks, so that leaves us with 2 active outbreaks in our healthcare system, 1 long-term care facility and 1 acute care facility. And there's no change in the number of people who have been affected in those healthcare system outbreaks. So we remain at 664 people in long-term care, assisted living, or acute care. We have no new community outbreaks, and no new cases in Haida Gwaii, the community outbreak in the north, and so that's very good news. We continue to monitor, however, and there are a number of people who remain within the incubation period, so new cases are certainly possible. There are now 59 cases associated with the Fraser Valley Packers, and that again reflects ongoing investigation in that setting. Again, there are many people who are who are contacts, who are self-isolating, and we continue to monitor, and Fraser Health is working with the facility to make sure that all of the appropriate infection control precautions are in place. I will remind people that there are no health concerns related to the consumption of fruit and vegetables, and from a location where people have been confirmed to have COVID-19, and that is something that we are fairly confident of now, having had a number of outbreaks around the world. But I will also remind you that it's important to wash fruit and vegetables carefully before eating them, particularly if you're going to eat them raw. And while it's not an issue for COVID-19, we do also have an outbreak of salmonella going on here in the province, and it's one that is under investigation by the BC CDC, and it reminds us of the importance of washing fruit and vegetables and produce prior to consuming them. We all know that in recent weeks, BC has faced an increase in new cases and new outbreaks of COVID-19, and that has been reflected in the numbers that we've seen over the past few days. Much of the surge can be connected to Canada Day activities in and around the central Okanagan, and particularly around the city of Kelowna. And what we saw is that when our groups are too big and we have too many people outside of our household bubble getting together, particularly when people are coming from different parts and they bring their risk with them, whether it's different parts of BC or different parts of Canada, or some people who are coming here from other countries. We know that the potential for the virus to spread increases, and we've seen the impact of that. Thankfully, we have not had, to date, much spillover into older people or into healthcare settings and other settings where we know the risk is higher that people are going to have severe disease or to die from this. However, when we brought this up and voiced our concerns to people in British Columbia, we now know that they listened. And I would like to thank people for that. Thank you for resetting and rejoining our efforts to push our COVID-19 curve down and keep it low and slow in BC so that we can manage this outbreak and continue to open up our society to have those important social connections that we need, as well as to increase our economic activities. And I want especially to thank the young people who have taken this to heart. I know it is an anxiety-provoking time. It has been a challenge for young people, whether it's teens or people in their 20s and 30s, where we don't know how long this is going to last, where many of the transitions and rituals that we have around graduation and starting jobs in university have been really rent asunder this summer. And I know that people, particularly around the Canada Day weekend, really had the need to get together, to have that joy of being together. And that is what we need to do for the rest of the summer. But we can do it safely, and we need to do it safely, and we've shown that we can. Many things may be different than what they were 6 months ago, but let's not forget that rise across BC. People have risen to the challenge, and we've done an incredible job. So let's keep this effort going this weekend and every weekend this summer. We probably all know somebody who has bent the rules to make it work for them, and that's not a surprise. I think until it hits home, we think we are immune to many of the effects of things like this virus. If you see them again, help them get back on track. Help them join the rest of us. Remind them that it is easy and possible to have fun, to socialize, and to socialize safely. To do this, let's keep our groups small. Let's keep a safe distance from others who aren't in our small groups or our bubbles, no matter where they may be. Although we may be physically distant, we do need to continue to have our strong social connections. And that is something that we have been able to do in really innovative ways across the province. And we saw that with graduation ceremonies. We see that with people getting together to celebrate births, to celebrate marriages. And I'm particularly impressed by the many young people and teens who have shown how to do this and how to do this well. Until we have an effective vaccine, we all need to find that balance of reducing our risks and increasing our social connectedness across the province. It's not too difficult to do, but it does require all of us to be involved and all of our effort all of the time. And it is the things that we do that protect our families, our communities, our seniors and elders who we value so much. So we will get through this. This is going to be our COVID summer, an unusual summer of doing things differently. But we know how to do it, and we will do it together. And this is how we can play safe and stay safe. Let's make this long weekend a different one than what we saw in early July. Whether you are 15, 25, or 55, celebrate our incredible province by socializing safely. The actions you take do make a difference, and we have seen that in the last few weeks. What you do today and this weekend will determine how we are going to be able to manage in the weeks and months ahead. So let's all do the right thing. It's how we care for our community, for our seniors and elders, for our families and friends. And this is how we can continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. And obviously today we're conscious and grateful that no one has passed away from COVID-19 in the past 24 hours. We're also grateful that there are only 5 people in hospital with COVID-19, which I think is the lowest number since the middle of March, which is a significant improvement, -1 from yesterday, and of course -144 from the height at the beginning of April, that only 2 people are in critical care. I'm going to make a couple of the reports that I make on Thursday now, one on surgery and one on visitations. And both of these areas, and Dr. Henry talked about maybe a different BC day than a Canada Day weekend in terms of bending the curve, but and understand that the successes we have, the fact that we can, at least in a limited way, have visits in long-term care, the fact that we are resuming surgeries to the extent that we are, is dependent entirely on what we do as a community to bend the curve on COVID-19. All of us can take satisfaction in the numbers of surgeries that I'm about to report. But we need to succeed if we're to succeed in this, as we have been succeeding going from stage 2 to stage 3 in terms of our economic renewal in BC, as we've succeeded in other healthcare measures, and as we will succeed in education. All of that ultimately is dependent on all of our efforts to do the things to follow the guidance of public health and the relatively small number but critical rules established by the provincial health officers to fight COVID-19. On March 16, 2020, as you know, we postponed non-urgent scheduled surgeries to ensure that hospitals could meet COVID-19 patient needs. On May 7th, we released our commitment to surgical renewal in British Columbia and started calling patients to see if they were ready to reschedule their surgeries. On May 18th, we resumed non-urgent scheduled surgeries. The surgery renewal commitment to patients and the significant changes it require saw achievement in June of the commitment to get back to the approximately 6,000 surgeries a week that were performed pre-COVID-19. These changes will also allow us to keep up with new demands for surgeries and complete the surgeries lost to COVID-19 within approximately 15 to 22 months, 2 months earlier than initially projected. The progress shown in our weekly reports and our first monthly report released on July 21st is encouraging. The work is complex, brings challenges, and it continues. Health authorities are doing the work necessary to extend OR days and in the future open ORs on Saturdays and Sundays. And of course, as you know, to reduce the typical summer slowdown significantly by 52%. Our commitment to surgical renewal is a massive undertaking. Our ongoing progress will continue to value the efforts, cooperation, and leadership of doctors, nurses, anesthetists, healthcare workers, and all the health professionals involved in surgeries, health sciences professionals in particular, in continuing the excellent work being done to ensure patients get the surgery they need. And with that, here's our 13th weekly update on surgical renewal, on our surgical renewal commitment. Between May 18th and July 26th, we completed 60,563 surgeries. 46,606 were scheduled surgeries, and 13,957 were unscheduled or emergency surgeries. That's 11,253 in Interior Health, 16,875 in Fraser Health, 13,893 in Vancouver Coastal Health, 12,511 in Vancouver Island Health, 3,521 in Northern Health, and 2,510 in the Provincial Health Services Authority. Last week, we reported 6,496 surgeries completed. As health authorities verify their data after the initial reporting cutoff for our weekly report, we update the previous week's volumes and report the verified totals the following week. This means there were an additional 163 surgeries completed between July 13th and 19th, for a total that week of 6,659 surgeries performed. This week, we are reporting 6,379 surgeries have been completed. As well, the number of patients contacted about their surgeries continues to increase and now stands at 70,579. This is an increase of 3,891 from July 19th. I would note that in this process, almost 5,000 patients have been removed from the surgical wait list. 1,695 have for the moment asked to continue to postpone their surgery for COVID-19 related reasons. This is significant progress, and I again want to express my gratitude to everybody who's delivering on the surgical renewal commitment. It is a true team effort, and as I noted, our progress will continue to count on each of us, everyone listening and everyone else in BC. The work each of us to stop the spread made it safe to launch surgical renewal and is key to the continued progress. I also want to update on visits in long-term care. As you'll know, on June 30th, we announced the easing of restrictions for visitors at long-term care facilities and seniors assisted living facility residences. I've been reporting each week on the number of facilities that have a written safety plan in place and that have started to welcome visitors. Last week, we reported 465 facilities with safety plans in place. This week, I can report that 513 facilities now have safety plans in place. We have 584 long-term care and assisted living facilities, so that's an increase of 68 from last week's 445. That means 88% of locations now have safety plans in place. I think it is reasonable to ask, and I certainly have asked these questions, about the remaining 71. Disproportionately, they are assisted living facilities, which have a different circumstance and standard than long-term care, where people have significantly more freedom to leave the facility and so on, and have throughout the pandemic. But I would also say this, that it's my expectation, and that expectation has been delivered to health authorities, that every single care home and assisted living home in BC will have a safety plan in place by next week. I have heard some people who have not yet been able to have their first visits with their loved ones, and I hear what you're saying, and I know the challenges, and these rules have been put in place by the provincial government and with the guidance of Dr. Henry, but it's our expectation that 100%, that I'll be reporting next week, 100% of care homes and assisted living residences in BC will have safety plans in place and visits happening consistent with those safety plans. In the days, weeks, and months ahead, we need to remember this. While BC travel is a welcome break from the local places we know, it is not a holiday from the skills that we've been taught to stop the spread. We must remember to pack our COVID sense and to use our COVID sense, no matter where we are in BC. And right now, whether at home in our community or as we travel to someone else's, we need to be even more dedicated to the actions we've taken to stop the spread. No matter where our travels take us over the BC Day long weekend and through the summer and into the fall, physical distancing must always be our closest travel companion. Physical distancing saves lives. As we celebrate BC, we know what BC stands for. We know it's British Columbia Day. It should also stand this weekend for Battle COVID weekend. It should also stand for Break the Chain. It should also stand for Bend the Curve. That would be a BC Day weekend to remember. Staying 100% all in our commitment to renew the fight to stop the spread will make this BC Day long weekend safe and fun and memorable for all the right reasons. Aujourd'hui, nous annonçons 29 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 3 591 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19, pour un total de 194 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 3 155 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Parmi l'ensemble des cas confirmés de COVID-19, 5 personnes sont actuellement hospitalisées, dont 2 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Et merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please also take yourselves off mute. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. When the restart program or plan was announced for the schools, you told us you have, quote, a great deal of confidence that this plan will be safe for the schools. Do you still stand by that station in spite of the objections that have been raised by the BC Teachers Federation?
Absolutely. And, I'm really grateful for the input that the BCTF has had in all of the planning that we've done. And I know that they are committed to doing the best that we can to ensure that our children have what they need and that educators have what they need in the school system coming up. But yes, this plan, the details will be worked out on an individual basis, but the framework and the bones of it are what we need to have in place to make sure that it's safe for children and it's safe for educators and it's safe for staff. And, that's the whole aim here. We have a long history in public health of working with our schools and working through all of the different things that we can be faced with, whether it's measles outbreaks or meningitis outbreaks, whether it's the pandemic of influenza we had, or now COVID. And these are the important things that we have in place to keep everybody safe. And we know we can do that. We've looked at all of the other essential workers that we've had working over the past number of months, whether it's healthcare workers, whether it's our police services, our fire services. We have found ways to work safely, and I expect that will happen in the schools as well. And we've had a good practice run in June where we've learned a lot about what things can work and what things aren't going to work, and that's been what has helped us to develop this framework, as well as learning from other school settings from around the world.
Do you have a follow-up, Bon?
Yes, please. The number of flights that have been flagged because there were exposures on them continues to grow. I think more than 24 now we've seen exposure alerts from the Center for Disease Control. You've referred, Dr. Henry, to the difficulty contact tracing people on these flights because there isn't effective information provided by the airlines. I guess, have you gotten anywhere in getting the message through to the airlines that this is difficult? And why are you able to use the powers that you have as Provincial Health Officer to compel them to make more details available so contact tracing can proceed?
I wish I had that power. Yes and no. I mean, I certainly can, but the reality of how their systems work, the booking systems and the systems that capture the flight manifests, they're only kept for a certain period of time. And what's actually in the booking system and the flight manifests don't always line up and don't always provide us with useful information. So yes, we do get the flight manifests, but it often takes days to get them, and they may not have usable information that allows us to effectively contact an individual. So if somebody booked through one of the online booking systems or from a travel agent, what shows up on the flight manifest is a name, but not always how we can get in contact with them quickly. So that is something that we have expressed our concern about many times over many years, and we've expressed it recently to the Ministry of Transport again federally. It is an important piece that I believe is part of how we keep air travel safe, as we need to eventually open up air travel for business, for some essential travel, for moving people, and eventually, hopefully, we'll get to travel for pleasure again. It's something that I would absolutely be looking forward to. So those are some of the things that I think are really important. We were actively trying to find people early on in this pandemic, and it was a challenging thing. And this is not unique to BC; it's across the country. It's in many countries, and we were able to work with Canadian Border Service Agency, Citizenship Immigration, the Public Health Agency. You can tell how complex it is to try and match things like people's passport information to their names so that we could have it more effective information. But again, that takes time, and it was done under the order that we had in place. When we put on a blanket quarantine order that anybody coming into the country had to quarantine, it became less important that we were able to identify people individually because we knew that everybody would be self-isolating. As we're moving into this next phase, it becomes, again, more important to be able to connect with people and ensure that those, particularly those right around a person who is identified as having COVID, are aware of their risk. It is still a relatively low risk, but it is definitely a risk that we would prefer to be able to notify people if we could do that in an efficient way.
Next question is from Shannon Patterson, CTV.
Oh, hi. First for Minister Dix. Today, the federal government finally acted on the Alaska loophole. What's your response to that? And do you think more still needs to be done when it comes to our land and air crossing?
I'm going to turn it to him, but I will say one thing, and I think it's great. I think that's a really helpful step, and it is something that that I'm thankful that has been put in place. I will also remind people who have traveled, whether you're Canadians who've come back to BC from traveling in the U.S. or anywhere outside of Canada, that you are, even if you are an essential worker, you still must obey our concerns around making sure that you obey the quarantine order and self-isolation. So a healthcare worker who has traveled to visit somebody who comes back must self-isolate, whether it's under the federal quarantine order or the provincial orders. And I'm saying this quite emphatically today because it's become, I've become aware of people who have traveled to the U.S. and are not, do not believe that they were subject to the requirements to self-isolate when they came back. And that is not correct. You are. The exemptions to the quarantine order, the federal quarantine order, mean that you are allowed to come back into the country. It does not mean you are relieved from the obligation of taking the precautions that we need so that you're not exposing your family and your community potentially.
Well, I'm tempted to answer what Dr. Henry said, but I'll add to that of course, we're delighted with that the federal government has taken the step. That you'll know that the Premier has been a strong advocate for such action. He regularly communicates that directly to the Prime Minister, both in their bilateral discussions and at discussions amongst premiers and the Prime Minister. So we're pleased with that. What more can be done? I want to join Dr. Henry in delivering the message, particularly for people traveling within Canada. It is not appropriate ever to get on a plane and travel sick right now. It's just not appropriate ever. And there can be issues and discussions with the airlines about manifests and so on. That is an individual responsibility. The screening at the airport, we would hope that the screening that takes place on flights from, say, Toronto to Vancouver would also reinforce that. But practically speaking, we want to deliver that message. That is also true for people who visit us by car from other provinces, say from Alberta to, I don't know, Salmon Arm or Kelowna or Vancouver. That, again, it is not appropriate in these times to travel sick, and it is absolutely necessary when you're visiting our province, just as it is for British Columbians who might visit other provinces, to follow the rules that you ought to follow at home, but in any event, follow the rules we have in British Columbia. I think we obviously have to continue, as you would understand, to extend limits on visits, the current limits to essential workers between Canada and the United States, that I would hope that would continue to be extended, and that we would continue to make the case and to ensure that people traveling within Canada are aware of their responsibilities with respect to travel, because it's critically important for all of us, for every province. This is a world pandemic and it's a Canadian pandemic, and we have to act that way and act respectfully. And we, as British Columbians, of course, we expect to be gracious hosts, but we also expect people to come here to follow the rules and regulations of British Columbia.
Do you have a follow-up, Shannon?
Yeah, for Dr. Henry, and I know you've spoken about this before, but with TransLink estimating less than half of people wearing masks, despite recommendations, and with back to school coming and other places like Toronto and Calgary making mask wearing on transit a requirement, why isn't BC moving to mandatory masks on transit? Why not say it is mandatory even if it's not legally enforced? Because that would convince some people who are on the fence to actually put that mask on.
Yeah, and that's an option that transit can do, and I think that's a particularly good option. And we also know that other retailers and stores have put that in place to protect their employees and to ensure, particularly if their spaces are ones where you can't maintain that distance, that is a measure that they've required in those settings. And I would also say that we need to obey those, and that I would encourage everybody to use masks in those settings where it's not always possible to maintain your safe distance.
Next question is from Richard Zussman, Global News.
Dr. Henry, we've been hearing, as I'm sure you have, a lot of feedback from people about the school plan announced yesterday. One of the scenarios that keeps coming up is this idea of parents with multiple kids in schools. Some cases there are teachers who live in the household, and so they're adding up the cohorts, 60 for one class, 60 for another, 120 for another. And in some cases, you now have what is in essence a cohort of 300. Are you concerned about these sort of circumstances? And what is your advice around before and after school care? And how should that work when that could, in essence, be an entirely different cohort with kids from many other cohorts?
Yeah, so this is the challenge that we all need to think about. So when we're talking about the learning groups that we're creating in schools, it doesn't mean that it's the same as your household bubble where you hug your mom and your kids and your sisters and brothers. It's about maintaining physical distance as much as you can, but recognizing that it's not always possible in those situations, and that you want to have your potential exposure group to be much smaller than an entire school. So for most schools, and we know the size of schools, it'll be 1 or 2 classrooms that'll be together. So it won't be 60, but the maximum is 60. And for older children, we know that they're better able to maintain their distances, and we need to have a bit more flexibility in the types of classes that they need to take to be able to fulfill their dreams and their needs around education. So because they're able to maintain their safe distances, to wear masks in appropriate times, to maintain the hand hygiene and other important things, there's a little bit more leeway in those people maximum number of people that you might contact over the period of a term or a year. So this is a way of managing what could be large numbers of kids that are intermixing and mingling, similar to what we're seeing with social interactions, where you maintain your physical distance, but your contact group is much smaller than it might be if you had 200 or 300 people at a party. So it is consistent with that concept of how we're doing this, and it will look a little bit different in different schools and with different age groups. But it doesn't negate the physical distancing. What it says is we know that we can't always maintain physical distance at all times in schools, so we're going to make sure that the risk periods are small and only with a small number of groups, or a small number of other students, so that we're not potentially exposing many, many others in different areas of the school. So that's the concept behind it. It takes a while to figure that through, and yes, it means that for certain families, that'll mean different children will have different contact groups. But we also have to balance the risks that we are trying to minimize in those settings with the very real risks that we know that children are experiencing now from being out of in-classroom settings. And that is something that we haven't maybe not paid enough attention to, whether it's mental health issues, whether it's food security issues, whether it's ability to have a safe home to go home to. There are many different needs over and above the educational needs that children have, where in-classroom settings are incredibly important. So it will be working things out, and each individual family will have to work it out based on their own situation. And that's something that we've known from the very beginning of this, that it affects different people differently. So in terms of aftercare, again, those are things that we're going to have to look at, and every family will have to make some decisions for themselves. And some of that will be who else is in the household bubble, the people that you do have consistent close contact with, and how do you minimize the interactions for people who might be at risk. So that might mean that there aren't certain after-school activities that are with another group of people. So those are things that we will work out, and every individual school and school district is looking at those things now.
Do you have a follow-up, Richard?
I do. Parents are still getting used to this plan, but we're hearing from some already that are just worried about sending their kids back in this situation for various different reasons. Do you foresee any way that there will be any type of virtual learning in the fall for those parents who decide they're not comfortable with the plan? And we're hearing in some cases that it's, vulnerable kids, immunocompromised kids, those that are worried about underlying health conditions that won't go. And advocates are saying that if they miss half a year, a full year of school, they'll never be able to catch up.
Absolutely, and that's why we have this plan in place. There are options. We're not saying that every child has to be in there. That is not what the plan says. The plan says the aim is to support every child in a classroom setting as much as we can. We know that there will be hybrid situations needed in some situations, and we know that there's access to online and other forms of education. But, those are questions for the Ministry of Education, the details of those. I will tell you that we're all anxious about this. None of us have been through a pandemic like this before. And we are looking at things carefully and thoughtfully and doing the best that we can to try and balance the risks of children not having in-school learning and all of the social and emotional and other factors that go with the positive effects of being in an in-classroom setting and having those interactions with their teachers and their instructors and the admin staff. And we are also balancing what we know is a virus that has very little effect on children for the most part, but does have effect on older people. And so how do we, we're finding our way in that. And we've been doing it in the healthcare setting. We're doing it in long-term care where we know the risks are great. We've been doing it in making sure that business and essential services keep going in our communities and our grocery stores and, all of those other settings. And we will do it in this setting as well. It's an important setting. It's critical to the future of our children and our communities. And this is why we've spent so much time making sure we're trying to find that balance, and the options are open to people. But I will also say, and this was a point that was made by one of the people yesterday, is that we have always had risks in our school. There is no such thing as no risk. And there's risks of measles, there's risk of influenza, there's risks of norovirus we've seen run through schools, we've seen pertussis, we've seen meningitis. So, these are things that we can deal with. And we've always had immunocompromised teachers, we've had immunocompromised children that we've accommodated in our school system. And we will be doing that again to make sure that we're doing everything we can to protect people, but recognizing that we have many risks in our community, in our homes right now as well. And what we all need to do in BC, and have been doing really well, is keeping our community transmission low, because that protects us all and allows us to make sure that our children are getting what they need.
Next question is from Lindsay Kynes, Times Colonist.
Hi, Minister Dix. I was just wondering, are you still planning to reinstate the waiting period for MSP and also to end temporary coverage for foreign workers with less than six months permits? And if so, why are you doing that when cases are surging?
Thanks for the question, Lindsay. So we made a series of changes around April 1st with respect to the medical services plan to make it easier in a time when, one, it was very difficult to get other forms of insurance. There was challenges with the federal government renewing permits and other changes. So what have we done and what will happen? And those changes were made for a temporary basis until July 31st, 2020. So what we're doing now for people in the following categories: if you have expired temporary work or study permits, and this was in response to some of the concerns that we heard from people, you may be provided temporary MSP coverage if you're currently living in BC, of course, you've applied for a new permit, implied status, you were previously enrolled in MSP as a deemed resident, and your MSP coverage has expired. In those cases, people need to contact Health Insurance BC to request this temporary coverage, and this temporary coverage will be valid until October 31st to allow and ensure people can deal with the federal government and possible delays there. So we made that change to assist that group of workers. With respect to the wait period for MSP, so I just wanted to put that in context because I think it's an important issue. On or around April 1st, we made the change to not have the wait period because of all of the difficulties. People remember what the circumstances were like at that time. We have what's called a 90-day rule, which means that, say you're working in California or you're working somewhere and are a Canadian, you return to British Columbia, for the first 90 days, you have to provide your own health coverage, and then you apply to MSP at maximum of 90 days, I should say 2 months plus the remainder of the month in which you apply. You have to provide your own medical health coverage. What this does is allows us to ensure that the public health care system that we have is able to provide services for people in British Columbia. So we have a 90-day rule, which means people cannot just come here, and on first day get health care and get that health care at the cost of everyone in BC, that there's a 90-day wait period. We did that. For practical reasons, we waived that and that 90-day rule at the height of the pandemic. But the 90-day rule will be put in place again, and it will be put in place as to August 1st. It's a necessary rule in public healthcare systems, and it ensures, in fact, that people in BC can get adequate coverage and adequate medical health services. It's fundamental to the way that we run our public healthcare system in BC, and the circumstances that led us to put these changes in place on a temporary basis are not there any longer. So the 90-day period will be reinstated, but for people on temporary permits whose permits may have expired and are having challenges getting them renewed at the federal level, we're extending those changes through October 31st.
Do you have a follow-up, Lindsay?
Yeah, and just with regard to the foreign workers with permits less than 6 months, I take it their coverage is coming to an end, and why are you proceeding with that?
In fact, that category of worker, we had very, very little uptake on that change to allow that coverage to exist for temporary foreign workers under 6 months. So that's something we'll continue to review. But the reason that's coming to an end is the same reason as the other things, that it was difficult for some people to ensure appropriate coverage in that period. In the April 1st period, it's clear to us as a result of the evidence over the last number of months that people do, in fact, have coverage. There was very little take-up of that. So we're just going back to what it was prior to April 1st in that case.
Next question is from Rob Buffum, CTV Vancouver Island.
I think this question is probably from Minister Dix, and it relates to what you were speaking about earlier. I spoke to two families today who have a loved one at a care home in Duncan, and they're frustrated because a month ago the government announced that visits would be starting soon, and they've yet to be able to see their loved ones. In both cases, the men have dementia and are declining quickly. I spoke to the care home who attributed the delay to the fact they haven't got funding from the government yet to hire more staff to make it safe. So I guess I'm wondering, what's your message to the families, but more importantly, what's your message to the care home?
Well, it's our expectation that people will provide safety plans to the government, and that you'll recall we're now at the BC Day Long Weekend, where we were at the Canada Day Long Weekend, and provide safety plans to their local health authority. In that case, it would be Island Health, and so this isn't people pointing at other people. It's my expectation that 100% of care homes and assisted living homes will have safety plans in place by next Thursday, and that's the circumstance. And so, and I want to say that I think that there has been extraordinary work by care homes and by health authorities, and to allow our visitation policy to go forward. And of course, many care homes, often they have weekly visits. People have had 3 visits already or more at certain care homes in BC. And so that it's possible and that the plan we put forward is prudent is demonstrated by the fact that currently we have, for example, only one outbreak at a care home in BC. It's a serious one, and it's at Holy Family. So the reason we have started slow with visits, with one designated visitor per resident in a care home, is for this very reason, because we wanted to ensure that it would be easy for people to apply the rules. It's our expectation, and it's our expectation in the coming months to have more visits and more possibility of visits in consultation with obviously care providers and others. So we've committed enormously to the process. Care homes received retroactive for the retroactive period from April 1st to June 30th, $26.5 million across the sector in supports. We're providing more money as we look forward to building out our visitation policy. That number is $160 million, which is a very significant amount of money. There have been $165 million made available to put in place the single site provision. So all of those are significant changes, and it's our hope and expectation that the modest start allows care homes to act, and in any event, it will be our expectation to see those policies next week. And I think care homes, all of them, are doing their absolute best, and I think everyone needs to understand as well that the one designated visitor per resident, that was a decision that we've made at a provincial level. So there's some people who are expressing their concerns, the care homes, about that limit. And the reason we put those limits at a provincial level is the same reason we've taken all the other steps we have. We're going to be methodical, we're going to start slow, and we're going to get it right.
Rob, do you have a follow-up?
I just wanted to clarify. In this instance, I gather from the care home, and from Island Health for that matter, they have submitted a plan, a safety plan that has been approved. So do I understand when you say that you expect by next week 100% of the care homes in the province to have safety plans, in place? Does that also mean that you expect by next week 100% of the care homes to be offering in-person visits?
I'd expect, given, and all of this work has been done together with the Nominational Health Association, obviously with health authorities, with the BC Care providers. But I would expect that people should be receiving visits. Obviously, it's not the visits that everybody wants. Frequently, it's a short visit on a weekly basis in care homes that have had for a number of weeks visits in place. But it's our expectation that plans will be in place. It's the reason we started slow. One resident, one visitor, one designated visitor, always the same visitor per resident, to make it possible to do. And it reflected the resources people have. And obviously, working with all of the people in the sector, we hope to expand that out in a safe way in the coming months. But we have to do it slowly and surely. And the money, well, I've described to you the very significant resources that have been put in place to support this. I'm very proud and pleased of the involvement of the Hospital Employees Union, of the BC Government Employees Union, of the BC Care Providers, and denominational health. So it's my expectation, yes, that people should be getting visits, and will be. If people wish to contact the Ministry of Health around these questions, we can work through the issues, and we will.
We have time for one more question. For any reporters that didn't get to ask a question this afternoon, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Health Minister Dix. I'm not sure who can best answer this. I'm hoping it's Dr. Henry, but do you have any confirmed cases linked in British Columbia to someone that was actually exposed to COVID-19 on a flight with someone who was sick on the plane? And also, if you have any cases of tourists that were exposing others, like you mentioned earlier, you're concerned about people not quarantining. So do we have any cases directly linked to that?
Not an easy question to answer, unfortunately. We have had many exposures over the period since January, when we started having people come from other places, particularly early on from China and then Iran and then many other countries, from the U.S. There have been people who have been sick, who have been exposed on an airplane, but they've also had other exposures. So it's very hard to tell which is the exposure that led to their illness. So it is a low but very real risk. And the more people that you have, the force of infection. We see this in many different settings. So the more people who are traveling from areas where there's an illness, and are on airplanes and are close together for longer periods of time, the risk increases. So we've had people who've arrived ill and who've developed illness. How do I say this? Yeah. So there's people come from countries where there's been a lot of circulating COVID, and they've all been on a plane together. They may have been next to somebody who was ill, may have developed illness once they arrived here, but it's hard to know if they brought it with them from the country of origin or whether it was acquired on the airplane.
Marcella, do you have a follow-up?
I do. There's been a poster circulating in Vancouver now that's advertising what I expect will be a large beach party at Third Beach, where we had the drum circle last week. What are you expecting local authorities to do to make sure that this event does not have more than 50 people? And from what I understand, it's not permitted. So I guess what's your message to anyone who might be thinking about
heading down to Third Beach tomorrow night for a party that is or is not sanctioned?
Well, I know it's not sanctioned, and I can say that I understand it was effective to put stern pictures of me up there scaring people away. But this is something that the Park Board, Vancouver Coastal Health, the bylaw enforcement officers, and environmental health officers have been working on over the last little while across the province, actually, and we've been doing compliance checks in beaches and resorts and other places in conjunction with the bylaw officers, with local municipal officers and public health and WorkSafe BC, and in some cases RCMP or other police. So I do expect that there will be compliance checks and that people will be reminded of the importance of physical distancing. And it may be that, if people are in small groups, separated appropriately, that they can enjoy being outside, enjoying music, enjoying the drum circles, and it can all be done safely.
Thanks, Marcella. And at a risk of channeling the Premier, I think people do need to give their head a shake a little bit here. But the things that we're most concerned about are the things we've seen in other places, which are indoor parties, which are less likely, although I understand some places have air conditioning, less likely in this period, but on this hot weekend. But indoor, close parties, if people are being invited to those parties where they don't know people who are there, and they're joining in those things, I think I would just say to them, this is not the weekend for that. Now, next weekend isn't either, and the one after that isn't either. But I think people have to look at those situations, look at parties, particularly indoor parties, which may happen on a BC day-long weekend or on any Friday and Saturday night or other nights, that they should look at that, look at those kind of events, and not go. And if there are events where everybody's invited, of course somebody at the event needs to take the responsibility for potential contract tracing purposes of identifying and writing down everyone who's at the event. So I think this weekend we can do this. We can absolutely do this. And it's not just a question of someone putting up a poster, whether it's permitted. We all have the responsibility, it seems to me, to look at that situation, to understand we're in a pandemic, to look around at the people we know and love, and to make the right decision. Thank you very much. Merci beaucoup.
Thank you.